Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to talk about mean cell volume, or we call that mean corpuscular volume. What is mean cell volume or mean corpuscular volume, or MCV? It is again the parameter of the RBC, or we can say it is a type of the blood test in which we check the average size of the RBC as well as their value or volume in the whole blood. This is called MCV. Then remember guys, if there is a high value of MCV in the body, in the blood we can say, so it means that RBC size is larger and we call that microcytic RBC. And if there is low value of MCV, so it means that RBC size are smaller than normal and it is called microcytic RBC. Now there are some purposes due to which we perform that test. What are the advantages of this test? This test, the main advantages or the purpose or the uses of this test is to diagnose all type of the anemia. Then the normal range. Now the normal range of MCV in both male and in female, we have 80 to 95 femtoliter. Now let's talk about that how we perform that test. For that test, first of all we have to take the blood in EDTA tube, and then we perform that test using hematology analyzer machine, as you can see. Now how we will first of all, this is, let's suppose, the EDTA tube. We remove the cap from the EDTA tube and then the needle, as you can see, it will be dipped into the blood. After that we press this one button. This is the button. Once it is pressed, so what happen, they will take a little amount of the blood and will this needle will then internalize. After that, after 5 to 10 minutes, they will 5 minutes after that they will give you the report, and they will not only give you the MCV report, they will also give you the all CBC parameters like TLC, DLC, MCV, MCH, MCHC, HCT, all the type of the CBC parameter. So let's suppose if we do not have this machine, or if we not afford it, so then how we find out it? We actually manually we find out it by using a formula, as you can see. Using MCV formula, we have the formula MCV is equal to HCT and RBC count. Okay, so this is actually the formula through which we can find out the MCV. As we already talked about, the HCT means hematocrit or packed cell volume. If you don't know about that, so I will recommend you that go back to my channel and watch this video lecture, that what is HCT or hematocrit. Now we have to divide the hematocrit value with RBC and then multiply it with the 10. So let's suppose we have the hematocrit value is 50 and RBC count is 5.8 or 58. So then we will divide it and after that we will multiply it. So then we will get the value 86 femtoliter, that is the normal range. Now there are different conditions through which the MCV value are get high, okay, in the in the blood, or why it get high in the blood, we can also say like that. Okay, now the main causes of the MCV due to which it get high, let's talk about that. First of all, we have vitamin B and folic acid. These two substances or molecules are especially important to make RBC or to maintain the level of the RBC. So just think about that. If there is a deficiency of folic acid and vitamin B, so the RBC level will be not maintained, so it will be get high, due to which the MCV value is also get high. Then we have liver disease. We better know that liver is especially important in metabolism. So if, let's suppose, if there is no metabolism, so what happen, the value of MCV will be high. Due to hypothyroidism, means if the thyroid gland not produce enough hormone, we call that hypothyroidism. and there is some hormone due to which the RBC level are maintained. If left supports the hypothyroidism occur, means low level of the hormone secreted from the thyroid gland. So what happened, the RBC level are also disturbed. Due to this way there is high MCV. Then we have autoimmune disease. Now how autoimmune disease can cause the MCV value high? Because autoimmune disease will attack on the organ which for example healthy organ we have bone marrow. So if the autoimmune cells attack on the bone marrow, so what happen, the MCV value will be get high. Okay, because we better know a bone marrow can secrete the blood cells. If it is let's suppose disturbed, so high number of the blood cell will be secreted, or abnormal red blood cell will be secreted. That's why it can cause the high MCV. Then we have aplastic and hemolytic anemia. In aplastic anemia, what happen, the bone marrow are disturbed and it will produce irregular shape of the RBC. And hemolytic anemia, the RBC are rapidly ruptured. So these two things are also can cause the MCV level high in the blood. Alcoholism. Now how alcoholism can cause MCV value to be high? It is that due to that when a person take a lot of alcohol, so what happen, this alcohol will disturb the bone marrow. So when the bone marrow are disturbed, so their function is also disturbed, so they will secrete abnormal large size of the RBC, due to which MCV value are also get high. Then there are some reason and there are some causes or condition due to which the MCV value are get low, or there are the disease in which the MCV value are the get low. First of all, we have the iron deficiency anemia. In this case, what happen, the iron, which are specially important to make hemoglobin, iron and protein are bind together, it make the hemoglobin. So just think about that, if there is iron deficiency, so what happen, RBC level are get low. So this is called iron deficiency anemia. Then we have thalassemia. In thalassemia, the hemoglobin are not formed, or low number of protein are formed, or globulin we can say, which can specially important to make the hemoglobin. So if there is low number of the protein, means globulin, so hemoglobin will be not formed. This is actually the genetic disease. So low number of the hemoglobin can also cause the MCV. Then we have spherocytosis. It means spherical structure of the RBC. If there is spherical structure of the RBC, so what happen, it cannot pick up the protein as well as the iron, due to which the hemoglobin will be not formed. And due to this way, the size of the RBC are become low, or the size of the RBC are become smaller. Due to lead poisoning, lead are actually the chemical substance that can make the heavy metals. So if the heavy metals are get burned, so what happen, if it is let's suppose taken through respiration, or if it is taken through eating, let's suppose, so what happen, it will stop the synthesis of hemoglobin. So when the hemoglobin are not synthesized, so RBC will be small. Then we have sideroblastic anemia, in which the iron concentration are high but the RBC concentration are low. Okay, so if there is low RBC concentration and high iron concentration, so what happen, there is the RBC level is also means the RBC size is also become small. So these are the condition in which the MCV value get low. So that's all about the MCV.